What ethical issues surround PGD savior siblings? Imagine a family with a sick child needing a transplant. They consider using preimplantation genetic diagnosis to create a healthy sibling who can donate tissue. This scenario raises many questions. Preimplantation genetic diagnosis is a process where embryos are tested for genetic conditions before implantation. When used to make a savior sibling, the goal is to select an embryo that is not only free of disease but also compatible to help the sick sibling. But this practice brings up important ethical issues. First, there is respect for the future child's autonomy. Parents choose embryos based on specific traits, including the ability to save a sibling. But the child born from this process might be seen as a means to an end, which can threaten their independence and personal rights. It's like using them as a tool rather than respecting them as an individual. Then there is the principle of non-maleficence, which means do no harm. The procedures involved in PGD and tissue donation, like bone marrow extraction or cord blood collection, carry medical risks. It's important to ask if exposing the savior sibling to these risks is justified, especially when the main purpose is to benefit another child. Beneficence is about doing good. Creating a savior sibling can save a life, which seems positive. But it's essential to balance this benefit with the rights and well-being of the new child. Are their needs and feelings being considered, or are they mainly seen as a donor? Justice is another concern. Some worry that selecting embryos for specific traits might treat children as products or commodities. There are also worries about social implications, like discrimination against people with disabilities or reducing genetic diversity by favoring certain traits. The moral status of embryos is also debated. PGD involves creating many embryos and discarding some that don't meet criteria. This raises questions about whether embryos have a moral value and if discarding them conflicts with respect for potential human life. Psychological and social factors matter too. The savior sibling might feel pressure to help or live up to expectations. This can affect their sense of identity and family relationships, especially if they feel their role is mainly to save someone else. Finally, there is concern about a slippery slope. While PGD for medical reasons is accepted, expanding it to select for non-medical traits could lead to eugenics or designer babies. That raises serious ethical worries about where we draw the line. In the end, using PGD to create savior siblings requires careful thought. It's important to weigh the risks and benefits for all involved, ensure informed decisions, and follow guidelines that protect everyone's rights. The key is respecting each child's dignity and making sure that the choice to use this technology is truly justified by serious medical needs.